Greetings, this is Dr. William Richardson, and I want to welcome you to this introduction to our disease reversal program. This is conducted by my clinic, the American Clinics for Preventive Medicine. The purpose of the disease reversal program is to literally reverse any reversible diseases or tendencies toward disease. We also offer lifestyle counseling and health coaching to help you along with any problems medically that you may be having. First of all, I want you to know that America has shocking and appalling health statistics. First, we have to realize that the U.S. ranks below other Western nations in key health indices, including below average life expectancy, poor infant mortality rate, and a great epidemic of chronic degenerative diseases. The United States also has high cancer rates, especially the lung, breast, prostate, as well as poor cardiovascular health stats, including lots of heart attacks, strokes, high blood pressure, and high cholesterol. We have to understand that health insurance does not ensure good health. In other words, you can have the best health insurance, but holistic complementary medicine may not be offered and may really be helpful. And this is what we do offer. It can be done in conjunction with so-called standard medicine. Really, I just believe in good medicine. We have to ask ourselves what actually causes health problems. 86% of health problems are caused by lifestyle factors, including lack of exercise, sleep deprivation, faulty dietary habits, as well as environmental pollution and yeast candida parasite infections, overuse or misuse of medications, nutrient deficiencies, and especially unbalanced mental emotional states. One can literally choose which disease you want. Many people have cancers, environmental pollution diseases related to heavy metal toxicity like chronic fatigue syndrome, which also is related to sleep deprivation. We have infectious diseases like hepatitis C, B, and HIV. We have many autoimmune disorders like lupus. Choose as many diseases as one likes, yeah? Well, there's an unlimited supply. Not even listed. Of course, we want to choose no diseases, none of the above. We would like great, vibrant health, outstanding vitality, and unparalleled longevity. That's what we want, and that's the goal of our disease reversal program. Of course, the choice is up to you. For instance, if you are following the standard regular American diet, you are choosing to be afflicted with America's epidemic of chronic degenerative disease. It's all about environment, lifestyle, diet, nutrition, exercise, sleep, etc. If you concentrate on working on these points, you will have eliminated or at least minimized the major causes of ill health. In our medical culture, we use medicines a lot. I see nursing home patients with sometimes 32 different medications. Medicines, first of all, should be used temporarily, not the rest of your life. Overuse and misuse of medications can reduce your well-being and lifespan. So, be sure you go beyond mere disease management or just suppressing symptoms. What we do in our disease reversal program is get to the root causes of your health problems. I want you to remember the saying that medicines are poisons with desirable side effects. So we do use them to our advantage at times, but they become a multi-trillion-dollar industry, and they are indeed a major cause of death and illness, even in hospitals. They even cause cancer, liver toxicity, and damage. They can decrease the immune system and even sexual function and libido. We can increase your chances of abating or stopping disease and improving your health in the future. Be smart. Make the decision to change your lifestyle, diet, environment, and it takes a great attitude. We will create a strategy that's complete and comprehensive through our disease reversal program. We will show you how to use self-love, the idea of self-improvement and holistic preventive medicine to help you abate or contain your current health issues. There's several questions I want you to ask yourself that we have actually thought of a lot. We want to know, what are the root causes of Western epidemics of these diseases? What responsibility do we have for our own quality and quantity of life? Are there good alternatives to drugs? And yes, of course, there are many times. And is it really necessary to be on a bunch of medications as we get older and have had several major surgeries? And it's really not. Further questions would be, what are the fundamental biological mechanisms that cause chronic disease, and can they be reversed? And what nutrients and lifestyle factors reduce chronic disease? And what about proper sleep, sex, outlook in life, exercise, meditation, digestion? How much can these prevent or reverse chronic disease? Other questions may have to do with how to eliminate or reduce free radical damage. And what about our toxic environment, stress, immune system deficiencies, and nutritional inadequacies? What role are those playing in chronic disease? And the answer, of course, is a very large role. I want us to look at the role big business has in chronic disease. Well, they are thinking about making big money. You look at the front end, where you have fast food, junk food, alcohol, tobacco, animal products. So then you have the back end, where you have all the medical industries built around chronic disease, like the open heart surgery industry, the cancer industry, health insurance industry, and even the funeral home. And you can imagine how ludicrous it is to have Big Macs in hospitals that do open heart surgery. There's a great conflict of interest there. Now I want to turn your attention to what our disease reversal program actually offers. We offer assistance. We want you to empower yourself. We want you to be enlightened, and we want to encourage and inspire you, and we want to help you be very motivated. We want to put you on a program to permanently correct health problems. During my many years of practice of medicine, we found that most of our clients make big mistakes with diet, nutrition, lifestyle, and environment that seriously cost them their health. Our disease reversal program goes far beyond mere disease management, suppressing symptoms, and crisis intervention. That's good when you have major trouble from disease and you can go to a hospital, you go to the emergency room. That's not what we do. We want to prevent you from getting there in the first place. Actually, when you really look at it, the disease reversal program we offer is the most important treatment that we have for you. This is because it addresses the 15 root causes of illness. Let's discuss those now briefly. The 15 root causes of illness include chronic bowel problems like constipation, toxic bowel, not enough good physical exercise, and not just wearing yourself out, but the internal exercise, poor digestion, American dietary hazards, not enough live uncooked food, and nutrient deficiencies, as well as even allergies to foods. Also, what about infestations in the colon and the mouth, like candida pathogenic bacteria? That means disease-causing bacteria. And what about the liver, being that it does 3,000 different chemical reactions that are unique to itself in the body? And what about water and environmental pollution, especially heavy metal toxicity, which the chelation therapy pulls out of the body? And what about the mind and the body, and how much stress we're under, and how to sleep properly? And we can't leave out certain infectious diseases as well. We will provide you with the tools necessary for self-empowerment. But you do have to study. You have to educate yourself. You have to be enlightened. You have to explore. You have to work at it on a daily basis and really want health. You have to take the time and make the effort to learn and understand how to rejuvenate yourself or regenerate your body, to renew yourself and to heal yourself. The disease reversal program will eliminate or minimize the use and need for medications. Of course, we also have to say, if you already know this stuff, why are you still sick? Because we have some people say, oh, I know this and know that, but you have to apply it. You have to apply it with the correct attitude, and you have to really work at it. So we get you to do that with our program. Now I want to dive into some background information that will explain to you why this is so important and why it works so well oftentimes. This is representing a study done by Dr. Burkitt. He was a medical missionary from England, a very hardworking man who, as part of his career, went to South Africa to serve mankind by studying and helping folks actually everywhere in the world, including his home country, England. Well, in this particular study, which is based on 1994 statistics, he divided the population up in South Africa into rural blacks, that's blacks living in the country area, and then urban blacks, then coloreds, which are genetically mixed blacks with other races like Indians and whites. Then you had the East Indians, then you had the European population in South Africa. He said the rural blacks could also be extrapolated or also associated with ancient rural Germans, ancient rural Australians, French, Native Americans, etc. So these are people living on the land, in other words. And if you look at the health statistics of this particular table, you will see that the rural blacks had no or zero coronary heart disease and very little of the risk factors, which as soon as urbanization occurred, the risk factors for heart disease like obesity, high blood pressure, and diabetes quadrupled or tripled. By the time you got to more fluent populations, then heart disease was entrenched there, along with stroke problems, dental caries, and femoral fractures, which represent osteoporosis. The next slide here, table 2, shows the great paucity or little incidence and prevalence of cancers in the rural black population. At that time in 1994, they had 0 lung, breast, colon, stomach, pancreas, and prostate cancer, whereas the other populations obtained them. The more affluent, the more cancers they got. Certain areas had endemic hepatitis B, that's why the liver cancer, ate something hot, esophageal, and had human papillomavirus. And when they moved to the city, they became more promiscuous, therefore spreading the HPV virus associated with cervical cancer. But for these big cancers hitting us in the United States, they had none. Table 3 demonstrates the paucity of non-infectious bowel diseases in the rural African or black population in South Africa in 1994. The rural blacks had virtually no non-infective bowel diseases. And that includes cancer, of course, of the colon, as well as ulcerative colitis, which represents the autoimmune disorder epidemic we have here. They didn't have any of that, and for very particular reasons that have to do with social as well as dietary issues. But they virtually had no ulcerative colitis, Crohn's disease, multiple sclerosis, lupus, etc. The last table of the study demonstrates the relatively lower fat diet of the rural blacks, and look at the fat intake increase with each step up the apartheid ladder. And when you get to America, European Americans eat 40 to 50% fat, and African Americans eat 50 to 60% fat. Compare those stats to rural blacks in South Africa eating a 10 to 15% fat diet. They also had a higher intake of complex carbohydrates as well as fiber. I want to present some of our very important and revealing patient testimonials to you, of which we have many. Mr. Moore came to us with coronary heart disease, getting chest pains regularly, and had had an angioplasty performed. And when we were able to treat him, he was walking normally. He was off of oxygen and all heart medications. He states, "I've been given a new lease on life." The next testimonial centers around several issues here. Gastric reflux was reversed, as well as great improvement in insomnia and hot flashes, and fatigue was reversed as well. And we appreciate her great success. Mr. Chris came to us 48 pounds overweight, having high blood pressure and cholesterol issues, and was found to also have prostate cancer. What we did, we used the disease reversal program primarily to reverse all of these maladies, and we of course used other modalities as well, like chelation therapy and intravenous vitamin C. He had a great response to all of these treatments. Using disease reversal, one of our disease reversal programs, as well as chelation, Ms. Curson was able to reverse physical and mental sluggishness and chronic fatigue, as well as depression, and had better immunity as well. Mr. Snow was able to use our disease reversal and chelation programs to normalize his PSA, get rid of his prostatitis, and gain more energy, strength, and endurance. He had key changes in his lifestyle via the disease reversal program. It's been said if you can control high blood pressure and high cholesterol, you can control heart disease. And again, through our reversal programs, we were able to address the root causes of his health challenges, and he made informed decisions based on that to adopt a healthy lifestyle permanently. This is another great example of what disease reversal and other ancillary treatments like chelation therapy can do. Using the dietary and lifestyle manipulations of the disease reversal program as well as chelation, we were able to get Mr. Miller off of all 7 medications. He had 3 open heart surgeries in the past and was headed for a 4th. And he's a remarkable man and still alive and well. From despair to happiness, no more pain, no more bypass, no more cardiac caths, improved libido, etc., etc. We use great disease reversal techniques as well as chelation therapy. Some folks use our therapies as a pure prevention, like Ms. Stockwell did. She's had over 120 chelation therapies, and she likes them because she feels it makes her young and healthy. Again, using disease reversal program, this lucky lady was able to get pregnant after 7 or 8 years of attempts. This is a great case. Violet Wilson came in with gangrene of her foot, and they were really definitely going to cut it off, literally amputate it. And her mother had her foot amputated, and she died 2 weeks later, and she did not want her foot amputated. Well, we used strong disease reversal counseling. We used other modalities like chelation as well. To this day, 7 years later, she still has her foot. Circulation is fantastic. Diabetes under control. Very proud of this case. Now I want to answer what the nuts and bolts of the disease reversal program are. What do you actually do? And what do we do for you as well? The disease reversal program actually is lifestyle counseling and health coaching, where we empower patients with the knowledge, tools, techniques, resources, motivation, and inspiration to do what? To regenerate, rejuvenate, and heal themselves. First, we identify health problems and challenges, conditions, preconditions, genetic predispositions, etc. Next, we identify and relate to the 15 fundamental root causes common to all disease states. We identify offending lifestyle, dietary, nutritional, environmental, toxic, mental, emotional, spiritual factors that may be contributing or causing your health problems. Next, we do an hour and a half of research on your condition specifically, concentrating on health challenges, lifestyle, history, health goals, and cleansing and detox procedures, and much more. After all that is done, then we have multiple one-on-one counseling sessions with myself, Dr. Richardson, or one of my staff to discuss and demonstrate, implement proper healing philosophy, protocol, techniques, tools, attitudes, effort, etc. We have a support system, and we want to introduce you to proper DVDs, CDs, and written materials, as well as a 13-page master handwritten program where we give you the necessary goals, objectives, techniques, and tools and resources to study and use and apply to regain and maintain your health. A comprehensive protocol for holistic medical treatments and testing, including nutritional IVs, IV chelation therapy, exotic lab testing as necessary. We go over all of that and much, much more. We use specialty products as necessary from around the world. Also included are manuals and handouts, books and resources, special dietary regimens and recipes, live food blends, juice formulae. We use sophisticated cleansing and detoxification techniques from colonics, enemas, flushes, proper diet for detoxification, as well as juices, teas, herbals, and other nutritional products. We use internal and external healing exercises and practices, and we really are expert on nutritional supplements and herbs. We have a complete list of establishments in this area and other areas for helping you to stay on a healthy lifestyle. We also introduce you to environmental awareness and cleanup procedures for both your body, your home, and the environment at large. We have several programs that we offer in our disease reversal program. We have the platinum and the gold, and we have other programs as well. Our programs vary depending on how many visits you have with our staff and myself. Everyone does get, it was 10 but now 13-page plan, and you get the various DVDs, CDs, manuals, and handouts. That varies depending on which plan you get. Our staff will be glad to go over these details and help you make the best decision for yourself. I want to thank you for listening to this presentation. This is Dr. William Richardson, and I wish you health and happiness. And I want to give you a call to action to make a great decision for yourself and sign up for one of our disease reversal programs today.